Bordeaux. I'm going to be doing an abdominal assessment on my patient. I'm going to first of all scan the room for cheat sheets. And okay, first I'm going to check my patient's chart. Second, I'm going to enter the room by introducing myself. I'm going to wash my hands. I'm going to provide for privacy. I am going to check my patient for 2 identifiers, and then I'm going to start my exam. Okay, I'm just going to go right into checking 2 identifiers. Meryl, can I borrow your armband to see can you tell me your name and your birth date?
Meryl Marsigan, 12/26/79.
Okay. Ms. Marsigan, do you have a name preference that you would like to be called by?
Meryl.
Meryl, okay. Meryl, can I ask you a few questions about what's going on today? Do you know why you're here?
Abdominal assessment.
Okay, yes, because your doctor ordered you an abdominal assessment since you're here. He wanted to just have you a full, thorough checkover. I'm going to ask you a few questions before about your history. Can you tell me a little bit about your dietary history? As in dietary, how is your fiber intake? Do you know how?
I think it's good.
You think it's good? Can you tell me a little bit about your appetite?
It's good. I eat breakfast, lunch, dinner.
Okay, can you tell me about what you had to eat all day yesterday?
Bagel for breakfast, then lunch, pasta, then dinner, pork.
Okay, do you ever have nausea?
No.
Okay, do you ever, can you tell me about your bowel movements?
It's normal, twice a day.
Twice a day for you? What's the consistency of it?
Soft.
Okay, is there an odor, a bad odor, or anything that you've noticed changing at all?
No.
Okay, tell me about do you have problems going to pee?
No.
Urinating, do you ever have any burning?
No.
Do you ever feel like you're incontinent?
No.
Okay. Do you ever have any blood in your urine?
No.
Okay. So, tell me a little bit about your periods. How are your periods? Are they painful, or do you have a normal period?
Normal.
You have a normal period. Do you have a lot of cramping that goes on?
No.
No, not at all. Can you tell me some of the medications you're on?
Just Flonase.
Just
Allergies.
Flonase?
Yes.
Allergies? Did I ask you if you had any pain right now?
No.
Okay. Do you have any pain?
No.
Okay. So, as I'm talking about the reproductive area, when was your last period?
Last month.
Last month. Have you had any pregnancies?
Yes, one.
One? Was it a natural or a C-section?
Natural.
Okay. But did you have any complications with the pregnancy?
No.
No complications?
No.
Okay. So, do you do breast self-exams for yourself at all?
Yes.
Okay, you do. Do you have any family history of any cancer?
No.
No cancer? Okay. First of all, I'm going to go ahead and since I got some subjective data, I can go ahead and start on the, moving into my patient's IAPP, inspect, auscultate, percuss, and palpate. By doing that, I'm going to bring my blanket down to the pubic line. I'm going to bring up underneath the chest, the breast area. I'm going to bring the pants right down, and then I'm going to just drape that there. By looking at the contour, I'm going to check her trigger. Her trigger is normal. It's no tenting noted. I'm going to notice the contour of my patient. She's flat with a small round. I can notice that her stomach is symmetrically, evenly moving. I don't see any masses, any lesions. Skin integrity is good. She does have some striae secondary to having a pregnancy a while ago. The striae color is pink. It's no longer purple since it's older, so it's really relaxed a lot. Her belly button is midline. It does indent. So the skin integrity is very well. My patient's skin is warm and dry. My skin tone is normal to the patient's ethnicity. I am not seeing anything that's abnormal. There's no hair distribution. Do you groom this hair area?
No.
That's a good way to ask. you groom the hair down here, and she doesn't groom the hair, so there is no hair, so she does not have any extreme over hair distribution there. There seems to be, anyway. Now I'm going to go into auscultate. When I auscultate, I'm going to listening for vowel sounds. By listening for vowel sounds, a normal vowel sound is 5 to 30 per minute. I'm going to see if she's hypoactive or hyperactive in her vowels. With the with the diaphragm. And we're going to go in a circular motion. We're going to always make sure when we're doing the abdomen that we're going to go in a clockwise. So I will start up here in the left. I should have started in the right, but that's okay because I can come back to it. When I was listening to her vowel sounds, she was approximately right now about 8 to 10 per minute. So I would say she's hypoactive right now. So next I'm going to listen to the arteries. I'm going to listen to the aorta that's above the mid-belly line, and we're going to come up underneath the contour of the rounded ribs where I can see the ribs meet. So we're going to come up underneath the ribs. And it's going to be here. Then we're going to come over to the left renal artery, and then I'm going to come down to the left iliac artery. If this was a real patient, I would be checking the femoral arteries as well. And in order to check that, I'm going to listen for bruise or swooshes. By doing that, I'm going to listen with the bell. There is no bruise or no swooshing noted. So my patients, there's no abnormal findings at this point. Now I'm going to percuss, and I would percuss all 4 quadrants. By percussing, I'm going to use my dominant hand by using, for some reason, there we go. I'm listening for tympani and dullness. We have tympani on the right and dullness a little bit on the left. So she's probably got a little bit of over the bowel, the ascending bowel area. So my patient right now is doing very well at this moment. Now I'm going to palpate my patient's stomach. By palpating, I'm going to be feeling for any masses, any herniations. Can you tell me if any of this hurts when I'm palpating?
No.
Okay. And by doing that, I would palpate. I would be, my phone, it's weird. By palpating, I'm feeling for any masses, and now I'm going to do the deep palpation. By doing the deep palpation, I'm going to be seeing let me come back to what it's called. But I want to, the rebound. I want to make sure my patient's rebound. When my patient is rebounding, I want to make sure that it hurts on the way up or down. Does it hurt on the way up or down?
No.
Up or down?
No.
Up or down?
None.
Up or down?
None.
By doing that, I'm looking for herniation, or I'm looking for any masses, any bulges underneath the skin area. As well, I'm making sure that I have good rebound. I'm making sure that I have good rebound, and that I cannot feel any masses, no hernia, no masses were noted. Her skin is perfect. Everything seems to be doing great with her today. So we are going to give her a clean bill of health right now. I am going to actually help her get back into, I'm going to help her pull back up her pants, pull down her shirt. I'm going to get on her grippy socks. I'm going to bring her bedside stand. I'm going to go ahead and get everything throttled back up. I'm going to give her her bed, pull up her bed rail. I'm going to go document everything. I'm going to do my hand washing as well. If this was a guy, a male patient, I would be asking my male patient about his peri-care, as well as self-exams, testicular cancer, if he had testicular cancer, if anyone in the family did. I would be asking a few questions about his, if he had problems urinating, if he had problems with his, any of the reproduction problems that he would be having problems with. And thank you very much, and I think I'm done.